Mass with ill or well-defined margins, with or without acoustic shadowing or as a complex cyst. On MRI, even if the lesion appears irregular in both shape and margin, with a rim enhancement, the key to diagnosis is a fat internal signal on unenhanced sequences without fat. Fat suppression, high on T1 weighted images. Dannert W., Radiology Review Manual, 7th ed. Ed. Philadelphia, PA, Lippincott Williams and Wilkins, 2011:577-8. Millet I, ETAL Pearls and Pitfalls in Breast MRI. BRJ Radiol. 2012, 85, 1011-197-207. 40. 47, C. To assess for .47. What is the primary role of a T2W fluid-sensitive sequence in an MRI shoulder arthrographic study with intraarticular administration of gadolinium? A. To check for glenoid labral tears. B. To check for articular cartilage integrity. C. To check for extraarticular fluid. D. To determine whether there is a full-thickness rotator cuff tear. Tear with communication to the bursae. E. To increase the visual contrast of the soft tissue structure. Extraarticular fluid. The purpose of the T2 weighted fluid-sensitive sequence in Mr. Shoulder arthrography is the identification of extraarticular fluid, for example, basal fluid or paralabral cysts, which may not be visualized on the isolated T1 weighted post-contrast sequences, particularly if there is no intraarticular communication. T2 weighted imaging also helps to identify abnormal fluid in the rotator cuff tendons by eliminating magic angle because of high TE. Berquist Th. Structures. 48. A 35-year-old man involved in a major RTA undergoes a facial series due to marked swelling and bruising of the face. All of the following are true of Lefort fractures except A. By definition, the pterygoid plates have to be fractured. B. Lefort I involves the maxilla and medial wall of the orbit. C. Lefort 3 involves the maxilla and the medial and lateral wall of the orbit. Chapter 3. Test Paper 2, Questions. 69. D. Lefort 3 is also called craniofacial disjunction. E. Lefort 2 fracture is also called pyramidal fracture. 49, A46. Th. MRI of the musculoskeletal system, 5th ed. New York, Lippincott Williams and Wilkins, 2006. 48, B. Lefort I involves the maxilla and medial wall of the orbit.